Hi, I am Cheryl Brady, and I am one of the co-chairs for the Memorial Hermann in the Pink of Health.
And I am Tiffany McClung, and I am one of the co-chairs for the Memorial Hermann in the Pink of Health. Our mission within the Pink of Health is to reduce the incidence of breast and ovarian cancer, as well as assist survivors in their journey. And the way that we do that, we actually raise funds year-round through our Pink Pals events, and then the pinnacle is our luncheon, where we raise the majority of our funds. We then are able to distribute those funds out to our partners in the community, who then provide education for all women for breast and ovarian health. They provide testing and treatment at no charge for women who do not have insurance or may be underinsured, as well as support to anyone who's battling cancer. And we're a group of 40 unpaid volunteers who are the most passionate, just beautiful women who are smart and tenacious. And the one thing that distinguishes us from other breast cancer charities is that all of the funds that we raise remain right here locally within our community.
In many cases, early detection can lead to more positive outcomes, increase your chances of survival, and also keep the cancer from spreading.
A really good example would be my mother, who is such a strong person and has always been an advocate for her health, and she gets her mammograms religiously year after year. And one year there was a discrepancy between the previous year's mammogram, and she couldn't even feel a lump. But with further testing, they found she did have breast cancer, and she's now a 17-year survivor.
And another example would be my grandmother. She's a 2-time breast cancer survivor. She always had her mammograms. She always went to the doctor. She listened to her body, and she's still alive today at the age of 88.
And we both have examples of friends that have ignored the signs. And I have a personal friend that ignored the pain in her breast and waited too long to go and get that mammogram. And she had a very aggressive form, and it took her life at a young age. And that's just devastating.
Every year, our allocations committee meets annually to decide how funds are dispersed out into our community. I'm very proud of the fact that all of our funds that we raise through In the Pink are reinvested back into our community. They help our local citizens in Montgomery County. This year, our allocations committee earmarked $25,000 to a legacy grant that was designated for cancer patients local in our community that had unforeseen circumstances. We're very proud of the fact that that money will be flowing back to patients who are battling cancer and who have also been impacted by Hurricane Harvey.
We were heartbroken seeing the devastation that Hurricane Harvey inflicted upon our community, but yet also inspired watching all the stories of people helping other people and coming to their rescue in our community, really pulling together. And we knew that was exactly what the Legacy Grant had been earmarked for. And for those people who were battling cancer before Harvey hit, they are still battling cancer after, as well as taking on the additional burden of Hurricane Harvey and what it's done to our community and to them personally.
And on a personal note, I know when Hurricane Harvey, in the days following Hurricane Harvey, one of the things that Tiffany and I had talked about is I had shared that my mother-in-law, who's fighting cancer right now, I remember thinking how thankful I was that she wasn't missing that appointment, that she was able to get her chemotherapy the week before. And Tiffany and I talked about the fact that there were still so many people who had to have their surgeries canceled, couldn't make their chemotherapy appointments because of the flooding on the roads. And that's still so important. That's why we've got to continue with our mission.
My name is Amanda Poole, and I'm the coordinator here at Canopy, actually where we are right now. And I know Cheryl and Tiffany have spoken to the different programs that they support here in the community. Canopy has been a beneficiary for the last 4 years of funds from the Luncheon, and we're just so thankful to you guys and all the hard work that you put in. I know it's not, it is a luncheon once a year, but it's 12 months of work, and we're able to provide programming free of charge to roughly about, I think our first year we were in operation, we had over 4,000 guests come through Canopy, and benefit from the programs that we offer, and we wouldn't be able to do that without you all. So thank you so much.
It's a great partnership, and it's partners like you guys and partnerships like the Rose and
Interfaith.
Interfaith Community Clinic.
Absolutely.
Partnerships like that make a difference in our community.
I think it's amazing that the funds that we provide, with the diagnostic mammograms, and if there is a finding, then the Rose can come in and complete that circle of care for those underinsured women or uninsured women, and I think that's incredible. And then we give them a safe haven to process all of that, and so it's kind of this perfect circle that we're all brought together through you guys.
We've decided to move forward with our scheduled In the Pink of Health luncheon on September the 29th. We just feel our mission is way too important to the members in our community. There are still women in our community who are underinsured or uninsured and need our help. We've got to stay true to our mission. Those that were fighting cancer before the storm are still fighting cancer after the storm. And in many situations, their circumstances are different and changed because they have flooding or they've lost everything that they have. So Tiffany and I just felt it was way too important for us not to have the luncheon.
And we also have great sponsors who have continued to sponsor us year after year, and those sponsors have encouraged us to move forward because they all have a heart for our mission as well. And so the luncheon will go on. It will be beautiful, and it will be a fantastic opportunity for people to come together and give back to the community that we live in and love.